Hypersplenism, a premature destruction of blood cells by the spleen. Hypersplenism is an overactive spleen. The spleen is an organ found in the upper left side of your abdomen. The spleen helps filter old and damaged cells from your bloodstream. If your spleen is overactive, it removes the blood cells too early and too quickly. The spleen plays a key role, helping your body fight infections. Problems with the spleen can make you more likely to develop infections. Splenomegaly means enlargement of the spleen. The spleen is located on the left side of the abdomen. It can be considered as two organs in one, since it filters the blood and removes abnormal cells, such as old and defective red blood cells, produces disease-fighting components of the immune system, including antibodies and lymphocytes. The healthy adult spleen weighs around 200 grams. However, a variety of disorders can cause the spleen to enlarge, sometimes to 2 kilograms or more. Any conditions that cause a rapid breakdown of blood cells, such as any of the hemolytic anemias, can place great strain on the spleen and make it enlarge. Other causes of splenomegaly include infections, liver disease, and some cancers. Symptoms of hypersplenism. Symptoms include 1. Enlarged spleen, which can be felt by palpating the abdomen. 2. Low level of one or more types of blood cells. 3. Feeling full too soon after eating. Stomach pain on the left side. Other symptoms, depending on the cause. Causes of splenomegaly. Since the spleen is involved in so many bodily functions, it is vulnerable to a wide range of disorders. Some of the causes of splenomegaly include 1. Cirrhosis of the liver, which can increase the blood pressure inside the vessels of the spleen. 2. Cystic fibrosis, a genetic disorder characterized by excessive mucus production, particularly in the lungs and pancreas. 3. Cytomegalovirus, a common viral infection that causes mild, flu-like symptoms. 4. Glandular fever, an infection caused by the Epstein-Barr virus. Hemolytic anemia such thalassemia, a genetic disorder that affects the production of the oxygen-carrying protein in red blood cells, hemoglobin. 5. Hodgkin's disease, cancer of the lymphatic system. 6. Leukemia, cancer of the bone marrow that affects the blood cells. 7. Lymphoma, cancer of the lymph nodes of the lymphatic system. 8. Malaria, a parasite transmitted to humans by the bite of infected mosquitoes. Diagnosis. Diagnosis of hypersplenism begins with review of symptoms and patient history, and careful feeling palpation of the spleen. Sometimes, a physician can feel an enlarged spleen. X-ray studies, such as ultrasound and computed tomography (CT scan), may help diagnose an enlarged spleen and possible underlying causes, such as tumors. Blood tests indicate decreases in white blood cells, red blood cells, or platelets. Another test measures red blood cells in the liver and spleen after injection of a radioactive substance and indicates areas where the spleen is holding on to large numbers of red cells or is destroying them. Enlarged spleens are diagnosed using a combination of patient history, physical examination, including palpation of the spleen, if possible, and diagnostic tests. A history of fever and systemic symptoms may be present because of infection, malaria, or an inflammatory disorder. A complete blood count is taken to check counts of young red blood cells. Liver function tests, CT scans, and ultrasound exams can also help to detect an enlarged spleen. Treatments, possibly splenic ablation, splenectomy, or radiation therapy. In secondary hypersplenism, the underlying disease must be treated to prevent further sequestration or destruction of blood cells and possible spleen enlargement. Those therapies will be tried prior to removal of the spleen. Splenectomy, which is avoided if possible. In severe cases, the spleen must be removed. Splenectomy will correct the effects of low blood cell concentrations in the blood. Vaccination for splenectomized patients. The intact spleen protects against serious infections with encapsulated bacteria. Splenectomy should be avoided whenever possible, and patients undergoing splenectomy require vaccination against infections caused by Streptococcus pneumonia, Neisseria meningitis, and Haemophilus influenzae. Treatment for splenomegaly depends on the underlying condition. For example, radiation therapy and chemotherapy may be used to treat cancers, while regular blood transfusions are needed to manage thalassemia.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.